Okay, so for the manual muscle testing for elbow flexion, what you're going to do is have your patient sit, and then you're going to have them take their arm, and depending on the muscle, so for the bicep, brachii, you're going to have them sit with their arm supinated, and then you're going to have them go up and then have them resist you, and don't let them push you down. And then you can brace their shoulder so that you isolate just that muscle. And then for, you'll put them in a more neutral position, so with their thumb kind of facing upward for the brachioradialis. And then you'll go through the same thing, so you'll have them resist as you press. And then for the brachialis, it'll be all pronated. So you'll have them pronate, and then flex, and then resist. And that's for grades 5, 4, and 3. And then for 2, 1, and 0, you're going to have them have their arm out to the side. And it's going to be the same setup as the grades 5, 4, and 3. But you're going to palpate for the tendon for the different muscles. And then you're going to have them attempt to flex in and just palpate for that tendon to have a reaction. So for the bicep, they're going to be supinated and then try. And then for the brachioradialis, they're going to be in a neutral and then attempt to flex. And then for the brachialis, they're going to be pronated and then try. And then that's for flexion. So for the manual muscle testing for elbow extension, you're going to have them lay on the table on their stomach or prone. And then you're going to support their arm underneath, kind of at the bicep, and have them extend it, and then relax it a little bit, and then you're going to put a downward resistance and have them hold it and not let you push them down. And that's for grades 5, 4, and 3. Come in. Okay, and then for grades 2, 1, and 0, they'll sit and then have the arm out to the side, and you'll palpate for the triceps tendon, which is going to be a little bit proximal to the olecranon, and then you're going to have them try to extend, and as they try, you'll be able to palpate that tendon firing.
For forearm supination, you're going to have the patient sitting, and you're going to position their arm so that they are supinated, and you will shake their hand pretty much for grades 5 and 4, and as they try to resist, they're going to be pulling back to supinate while you try to force them to pronate. For grade 3, they suggest that you grab the wrist up here to avoid causing any further injury. For grade 2, you're going to support the elbow and ask them to supinate and look at their hand. And for grades 1 and 0, you will support their wrist, and you're going to palpate the supinator that is just distal to the radius and ask them to turn their hand toward the ceiling. For forearm pronation, you'll have the patient seated and ask them to pronate their hand, and then as you shake their hand, you're going to try to supinate them while they maintain pronation. And for grade 3, they suggest that doing it at the wrists as well. For grade 2, you're going to support the elbow and have their hand just in the middle, and then have them turn their wrist outwards to pronate. And then for grades 1 and 0, you're going to palpate the pronator teres as they attempt to turn their wrists towards the floor.